Dixie Dolphins. How are you? Today is my first interview, and I have this lovely lady. She is Nurse Davis, and we are going to interview her today. And I'm going to put her so that we're in a gallery together. So we'll be together in two, like this. And then that way we're on the same screen together. And I just want to say hello and welcome and just sort of talk a little bit about yourself.
Thanks. Hi, Dixie Canyon. I've heard a lot about you because I am Miss DeMarco's sister.
Woo! Miss Fight On, of course.
Yes. And how lucky my parents are that they raised a teacher and a nurse. That's perfect. I went to USC's nursing school many, many years ago. Yes. And I'm a proud Trojan, just like Miss DeMarco is.
And me too.
Yes. My work history is I started when I graduated from USC, I started in the emergency room, and I worked in both adult and pediatric, that's children, emergency rooms. And then after I had my children, I moved on to interventional radiology, both adult and children. And currently I'm doing what's called vascular access, which is putting in the big, long, fancy IVs that you have to be specially trained to place those for the patients.
Oh, well, that sounds complicated. I would faint, of course. So how long have you been a nurse now?
36 years.
Wow. And you love it, and it's tough, and
I love every minute of it. I wouldn't change it at all. I loved being in the emergency room, and during this kind of crazy time of COVID, which I think we're going to talk about in a minute, they actually asked us, all of us nurses, if we would go back to our department of origin, and I said, absolutely, I'll go back to the ER in a minute if they need me.
Oh, that's great. We have a visitor, some kind of bird in the back.
Yes.
So what we really want to know before we start talking about the other stuff is how Miss DeMarco was when she was a little girl.
Well, she is 6 years older than I am. So she was always, in my eyes, very much more mature and grown up than I was.
She fooled you.
Yes, she did. And we shared a room. So imagine I'm a 10-year-old and she's a 16-year-old and we're sharing the same room. That was quite difficult for her. But she was a very good, protective big sister and took good care of me. And even though I did things like borrowed her clothes without asking, yeah, she tolerated it, and we're best friends now.
Now she's so fashion savvy.
Yes.
She has to have everything matchy. She's the best.
You know, yes, she's always been like that.
A bag for her shoes and her outfits. She's awesome.
Yes.
So let's get back to what we were going to talk about, because I want to acknowledge that it was a whole week for nursing, and actually the 12th is the last day to celebrate nurses, and that's why I put it on the virtual, and I want to put this on our website so that we can acknowledge you and everybody else in the field, how much they're doing for us, and just the rest of the country and the world, acknowledging how important it is to have nurses and doctors and to take care of us, and not that they're not so afraid, which they're probably terrified every day. But I want you to kind of give your perspective for children and to tell us what PPE is, because they throw these acronyms, ABC, 1, 2, 3, all that stuff, and everybody gets confused. So I want you to help us out.
Everything we do in healthcare is an acronym, as you mentioned. PPE stands for protective personal equipment, or personal protective equipment, excuse me. And that's a variety of things from, in my case, I wear a hair cover when I go in to see a patient. I wear goggles or eye protection when I go in to see a patient. I wear a mask, and with the COVID patients, also an acronym, COVID being coronavirus 19, 19 standing for 2019, the year that it started. I also wear 2 masks, and I'll show you in a minute why we wear 2 masks. I wear a gown, and I wear gloves, and I wear shoe covers. That's all my personal protective equipment that I wear. When we go into the room, we wear what's called an N95 mask, which mine looks like this. Can you see it? And we don't recommend that you all wear these out in the streets, because I actually have to go to a class to be fitted for this, to make sure that it fits me properly. And the reason I know this one fits me properly is because my straps are this red color. There's other colored straps for a large or a medium size mask. So I have to be tested every year to make sure that this fits me properly and I'm placing it on my face properly. Now, construction workers also wear N95 masks, and they look like this. Little different than ours. Ours are very, very fitted. When we wear the N95, the 95 stands for it's protecting us from 95% of the things we're breathing in. So that's how much it's taking care of, so that we don't breathe that in. So I'm going to wear an N95 mask, and then I'm also putting over what's called a simple mask, or I don't know if you can hear me or not. This is a simple mask or a surgical mask. This is what they wear in the operating rooms. And the reason they can wear this, just a simple mask in the operating room, is because the operating room, the air is actually filtered. So all of those pollutants and bad things that could infect a patient are blown out. So a simple mask is good enough in the operating room. When we go into these very, very sick patients, not just the COVID patients, but somebody with tuberculosis as well, or a really, really bad case of chickenpox called shingles, we're going to wear an N95 and a simple mask. And the reason we're double masking is not because it's going to give us extra protection, but because the simple mask is going to protect the N95 mask, so I can re-wear the N95 mask later. So that's why we're doing it. Okay. So when you see people out in the streets or at the grocery store wearing an N95 mask, it's really not necessary. Or this, it's not necessary. This is good enough out at the market and in the streets.
Okay. Great.
We're also wearing 2 sets of gloves for the same reason. I'm going to go into the room. I'm going to do whatever I need to do with the patient. I'm going to touch a bunch of stuff. And now when I leave the room, I'm going to take that first set of gloves off that are dirty, and I'm going to throw them away. Now I can touch the door with my second set of gloves, go outside of the room, take off all of my gear with a clean set of gloves.
That's great. So, wow, that must take you a long time to put all that stuff on.
It does, and we actually look at our times and how long it takes us to do things. And one of my coworkers timed us the other day. We were going to go in to place one of those fancy lines, and it took us 30 minutes to get geared up to go in the room, both of us, as well as we take some equipment in, and we had to protect the equipment before going into the room as well. So it took us a longer time to go in and come out.
That's crazy. That's really, it's a big job to do all that. And so one last thing I want you to tell us is, I want my kids to be really safe, and I want my families to know how important it is. So can you give us some advice on what's really important to do during this time? And if you can just help us out.
Yes. The most important thing is to wash your hands. And your parents have probably told you that 1,000 times, but that is the most important thing you can do. The Center for Disease Control is talking about 20 seconds of hand washing. In the hospital, we actually do 30 seconds worth of hand washing, so a little bit longer. And the way you can know if you're doing that long enough is to sing happy birthday twice when you're washing your hands. Or as Ms. DeMarco likes to say, to sing the Trojan Fight song while you're washing your hands.
They know.
Yes. So it's really, really important to wash your hands. So now let's say your hands are clean and you're good to go, but I just did it a few minutes ago. You touch your face, you touch your nose, you touch your hair. Now your hands are dirty again. So the only thing that this mask does is to keep your dirty hands off of your nose and your mouth. And it also protects, if you're sick, it protects the other people. That's what the mask is for. So it's really, really important to not touch your face, not touch your hands and your nose, because let's say you go to the grocery store and you're helping your mom push the cart. That cart, you don't know how clean it is because you didn't clean it. So now your hands are dirty and you pick up the apples that you want for your lunch. Now they're dirty. So to be very careful. Even the people who wear gloves in the grocery store, they're touching the cart or they're touching the keypad to pay. That's all dirty. So those gloves aren't really protecting them once they've touched dirty stuff. So it's really, really important to wash your hands. Be conscious of what you're touching, if it's your hair or your face. And if you're sneezing or coughing, you need to cough into your elbow or cough into a tissue and throw that tissue away. You need to make sure that you're not touching your friend's face and touching their stuff, because you don't know where their hands have been. And now it's on, goes from their desk to your desk or whatever the case may be. So it's really, really important that we keep our hands clean, we keep our stuff clean, we don't touch our noses and our mouths, because you don't know where the germs are. And if you're sneezing or coughing, you're in the crook of your elbow or in a tissue and throwing that away.
Great. So thank you so much for being with me today. And thank you so much for just being a great sister to your sister, good friend to her. She's lovely. I love her. And, have a wonderful, wonderful time. And please keep safe. And if you can visit us again, that would be wonderful. But if there's anything that we can do for you, if you think that the hospitals, or if you know of any place that could be, that we could write a note to, or what, something that we could do to show how Dixie Dolphins behave during a crisis, let me know, okay?
Thank you. Thank you.
So much. I really appreciate this. Thank you. I'm going to stop the recording.